Hello everyone, my name is Justin Kang and I'm a periodontist. I received my dental degree from University of Pennsylvania School of Dental Medicine and went on to complete my periodontics residency at Columbia University. I'm a diplomate of American Board of Periodontology. I'm currently in private practice limited to periodontics in Franklin Lakes, New Jersey. Our patient in this case presented with a long history of edentulosum at site number 9. She was wearing a Nesbit appliance, and you can appreciate the irregular and friable soft tissue anatomy resulting from the appliance. When we took the preoperative CT scan, a hard tissue deficiency in the horizontal dimension was noted. Therefore, the primary therapeutic goal was to regain the horizontal dimension of hard and soft tissue in preparation for prosthetically driven implant placement in the future. When we look at the patient's risk profile, patient presents with a history of fixed restorations on the adjacent teeth, with a high smile line and medium scalloped gingival architecture. Patient also has a parafunctional habit and lack of mutually protected occlusion on her left side, which was taken into consideration as part of our comprehensive treatment planning process. Our treatment goal was to regain the horizontal hard and soft tissue dimensions through guided bone regeneration. For our surgical procedure, a combination of Geistlich Bio-Oss small granules and autogenous bone chips was used, along with Bio-Gide membrane. A full-thickness flap was raised using sulcular incision, and a paracrestal incision toward the palatal aspect at site number 9. A single vertical incision was made distal to the recipient site. Following flap elevation, periosseal release was completed for tension-free primary closure, and decortication was completed at the recipient site to receive increased vasculature to the graft and for regional acceleratory phenomenon, or RAP. Autogenous bone chips were collected from adjacent areas using the Geistlich Safe Scraper and mixed in 1:1 ratio with Bio-Oss. Bio-Gide membrane was placed over the graft material and stabilized using tacks both facially and palatally. Tension-free primary closure was achieved and the Nesbit appliance was adjusted to avoid contact with the surgical site. Following soft tissue healing, adjacent teeth were prepared to receive a fixed provisional, and at 4-month healing, you can appreciate the tone and contour of the soft tissue. When looking from the occlusal view, you can truly appreciate the gain in the horizontal dimension, which will allow us to place a prosthetically driven dental implant. When reviewing the surgical approach to this case, the combination of Bio-Oss and autogenous bone chips provided the best chance for regeneration while maintaining hard and soft tissue dimensions. Some of my keys to success include identifying and understanding the aesthetic needs of the patient, prosthetically driven surgical therapy that is based on ideal tooth position, incision and flap design to provide adequate blood supply to the graft is paramount, and this includes adequate release of the mucogingival flap to achieve and maintain primary closure throughout the course of healing. The use of the Geistlich Smart Scraper allows for predictable harvesting of autogenous bone chips. And finally, stabilization of Bio-Gide membrane with the use of fixation pins and sutures is critical to successful outcome. In summary, Geistlich Bio-Oss is a biocompatible and osteoconductive bone graft material that also has a low substitution rate. These properties will result in predictable regeneration while maintaining ridge dimension. Geistlich Bio-Gide, with its unique bilayer structure, not only prevents the ingrowth of soft tissue into the augmented site, but at the same time integrates well with the surrounding soft tissue. I would like to thank Geistlich for the opportunity to share one of my favorite cases, and thank you very much for listening.